Hey everybody, I'm Dr. Nick Circle. I'm so excited to be here as always. Today we're going to be talking about the foot. We're going to be talking about foot pain, how to correct foot pain and how to prevent foot pain. The reason why we're going to be talking about this is because in the next several videos, we're going to be doing some balance exercises. Now don't forget, subscribe to our channel and hit that notification button to get more of our videos. We need those feet to be right. You know why? Because the foot is the foundation for everything. If our foundation is off, the rest of us are going to be off. Think about this. When you're building a house, what's the most important thing that we have in a house? It's the foundation. If the foundation is not on solid ground, what's going to happen is the rest of the house is not going to be structurally sound. Same thing with the body. If the feet are not structurally sound, we're going to have problems that go all the way up the kinetic chain. I will tell you this. I know it sounds kind of strange. Foot pain can cause neck pain because our whole alignment has been thrown off. There are 30 bones in each lower extremity. The foot has 26. If they're not aligned properly, it's going to throw off everything. How do we get this fixed? And what kind of problems are we having in our feet? The biggest problem people have is plantar fasciitis. It is extremely painful and takes an extremely long time to get rid of. There's different ways that it's treated. Some are good, some are not so good. Some are beneficial, some are not so beneficial. What we do is we look at the foot from a structural aspect. How is the foot working? Are all the bones working in unison or in synergy? If they're not, let's fix it. Could it be a problem with a knee causing a foot problem? Possibly. Could it be an ankle causing a problem with the foot? Possibly. So that's where we start. We start with the foundation and we work our way up and we find out what's going on. Patient comes into the office and they say, my foot hurts. Why does it hurt? Was there trauma of any sort recently? Have you had trauma in the past? Sometimes what we can do is we'll take an x-ray of that. We'll find out what the bones look like. Majority of the time, we're not taking an x-ray first of the foot, unless we suspect that there might be a broken bone or ligamentous damage. Since there's so many bones in the foot, it's easily palpated. So we can palpate those areas. Most of the time, foot pain is related to soft tissue injury. Plantar fasciitis is a form of a soft tissue injury. When I have patients that have had plantar fasciitis and they've been in the office, they've had all kinds of things done to them, and we go in there and we adjust that area, instant relief. Podiatrists will first look at the foot, and they'll look at the soft tissue, they'll look at the hard tissue, and their mode of treatment would be injections, immobilizing the foot, adding a orthotic to the foot to help stabilize that. Well, I'm all for orthotics, and we'll talk about orthotics. Orthotics are specifically designed to help stabilize the foot. People ask me all the time, if I get orthotics, is that going to help me? Well, yes. If you walk barefoot all the time, no, it's not going to help you. I personally wear this type of orthotic in my shoes, and I have for the past 30, 35 years. And let me tell you something, and this is just for me. I'm not saying, oh, everybody should get an orthotic. But if I don't wear my orthotics, I start to have knee pain and back pain. I wear my orthotics every single day. If we're going to use an orthotic, stabilize the foot, we need to make sure that it's correct before we put an orthotic on. We'll adjust those areas. We'll do soft tissue adjusting, osseous adjusting, and we'll get that foot moving the way it's supposed to, and we'll get you out of pain. We'll also give you specific exercises, then scan you for the orthotic, put it in, and that way, now the foot is stabilized and the foundation now is solid. So everything above that foundation can now start to restore and get back to normal function. As we go through working with the foot, remember, it's a foundation. It's where everything starts. We're standing on our feet all the time. We're walking all the time. So if you're a runner, everyday walker, if you stand a lot, if you have back pain, if you have knee pain, if you have hip pain, you need to have your feet checked to make sure that the foundation is solid. Because if that foundation is not strong, you're going to have problems in other areas of the body.